Dr. David, I'm sending over Mr. Thomas for a checkup before his operation. He's having a keyhole surgery next week.
Thanks, Dr. Mihira. I'll set up a time for Mr. Thomas to come in. What does he need to do to get ready for the operation?
We'll need to make sure Mr. Thomas is in the best possible health for the surgery. He'll need to fast before the operation and avoid some medicines.
I'll give Mr. Thomas clear instructions about how to prepare before the operation. Are there any specific worries or things we should watch out for?
Mr. Thomas has a history of high blood pressure and sugar problems. Point 1. We'll need to manage these carefully before the surgery.
Dr. Mihira, I'll look at his medical history and make sure he's taking his medicines as he should. We'll also need to see if he's at risk of any problems and take the right steps to prevent them. MIHIRA, it is completely normal to feel a bit anxious about what comes next after cleft lip surgery, but rest assured that your little one is on the path to healing. In the coming days, you will likely notice a few mild, temporary after effects that are a natural part of the recovery process. Mild swelling and slight bruising around the lip and nose are very common, along with a little bit of clear or pinkish oozing near the delicate surgical site. She might also experience a bit of nasal congestion, which can make her feel a little fussy or lead to a decreased appetite since eating might feel slightly uncomfortable at first. Keeping her pain well managed will help immensely with her comfort and feeding. You can administer age-appropriate analgesia, such as liquid paracetamol, following the exact dosage instructions provided by your care team or the product packaging based on her current weight. Offering gentle comfort, keeping her ear and facial area protected as advised, and giving her plenty of quiet rest will help her bounce back quickly.